Hello, my name is Jay Wong. I'm a fourth year pathology resident in the United States. I will graduate in a week. And I go over cases almost on a daily from head to toe, different organ systems. So if you're into that, consider giving a like and subscribe. Without further ado, let's use University of Pittsburgh Department of Pathology and go over case 1101, a long-standing, slowly growing distal thigh mass in an adult female. Thank you to Dr. Nayaz and Dr. John for this case. So this is a female in her 40s with no significant medical history, presented with a slowly growing, long-standing soft tissue mass in the left lower thigh. MRI revealed 4 masses ranging from 0.4 up to 1.7 centimeters, involving the rectus femoris and vastus lateralis muscles. The masses were well defined with iso-intense T1 and slightly heterogeneous hyperintense T2 signal. Concurrent CT of the abdomen and chest demonstrated multiple lesions in the lungs, liver, and spleen compatible with metastasis. Histology, the biopsy and subsequent excision of the thigh mass demonstrated epithelioid cells arranged in a nested and pseudoalveolar pattern. Figure 1A. Not the clearest or the best resolution, but this nested and pseudoalveolar pattern, I'm thinking epithelioid soft part sarcoma. Vascular spaces were noted focally, figure 1B. On high power, the tumor was composed of nests of large epithelioid cells with abundant glassy to vacuolated cytoplasm and well demarcated cell borders separated by fibrous septae, figure 1C here. Notably, the tumor cells were positive for CD31, ERG, and TFE3. Alright, so CD31 and ERG are vascular markers. TFE3, that's pretty specific for alveolar soft part sarcoma, which is driven by an X17 ASPS-CR1 TFE3. ASPS stands for alveolar soft part sarcoma. So while negative for pankeratin phos-B and CAMTA1. So it's an alveolar pattern. It's not rhabdomyosarcoma because rhabdomyosarcoma will not be as epithelioid, meaning that there's abundant cytoplasm. It'll be more blue. So figure 1, the tumor shows a nested and pseudoalveolar growth pattern. Vascular spaces were noted focally. The nested tumor cells were composed of large epithelioid cells with abundant glassy to vacuolated cytoplasm. Next-gen RNA sequencing performed on formalin-fixed paraffin-embedded biopsy tissue identifies YAP1 TFE3 fusion. Interesting. So alveolar soft part usually associated with ASPS-CR1, but there's a YAP1 TFE3 fusion. So could it be something else? Let's see. Wow, okay. So this is a YAP1 TFE3 rearranged epithelioid hemangioendothelioma. YAP1 TFE3 rearranged hemangioendothelioma is an extremely rare malignant vascular tumor that is distinct from its conventional counterpart. The latter is often characterized by WWTR1 CAMTA-A1 gene fusion. YAP1 TFE3 rearranged epithelioid hemangioendothelioma shows a slight female predominance and occurs more commonly in young to middle-aged adults. Roughly half the cases present with multifocal disease. Morphologically, these tumors are composed of nests of epithelioid cells with voluminous, often brightly eosinophilic cytoplasm with occasional vacuolization and prominent nucleoli. In contrast to conventional epithelioid hemangioendothelioma, these tumors often show areas of vasoformation. By IHC, the tumor cells are positive for vascular markers, including CD31 and ERG, as well as TFE3. So I guess that's where you could, in hindsight, tell that it's not alveolar soft part sarcoma because it's not a vascular tumor. So CD31 and ERG shouldn't be positive. And cytokeratin expression is variable. Unlike their conventional counterparts, these tumors are consistently negative for CAMTA1 IHC. Finally, patients with YAP1 TFE3 rearranged epithelioid hemangioendothelioma has a more favorable outcome than those with WWTR1 CAMTA1 gene rearrangement, with overall 5-year survival being 86% versus 59%. In conclusion, YAP1 TFE3 rearranged epithelioid hemangioendothelioma is a rare malignant vascular tumor that appears to be distinct from conventional epithelioid epithelioid hemangioendothelioma in terms of its clinical, pathologic, and genetic characteristics. All right, I know that was a little bit more in the niche, but I mean, now we know, and not all TFE3 entities are alveolar soft part sarcoma. I'll see y'all next time, and have a good one. Bye.